Welcome to Bold Moves Radio. The show is Prudent Woman with myself, Rulani Baloi. We are excited to have you joining us once more. Thank you for all of you who have subscribed to our YouTube channel, that is Bold Moves Radio, and all of you watching us on Facebook. Thank you for joining us, and everyone else listening to us on Bold Moves Radio. You are welcome, and thank you so much for joining us. We invite you to have this conversation with us. You can drop down your comments, your questions on 081 358 8745. Those on the social media platforms, YouTube and Facebook, you are welcome to send you through your questions or your comments on the comments section. Thank you for joining us. This is another day that the Lord has given unto us to be empowered, even as we continue with the month of May, the month in which we celebrate motherhood. Today we have with us here right in the studio, Dr. Glen Rose Rukoto. She's a pediatrician. She will be talking to us, even as we said, when Mother's Day started, they were sitting and talking or teaching each other on how to take care of their children. And as Prudent Women, we saw it fit that we have this woman, our doctor, to come and teach us, understanding today's setup, the household setup, because most of us, we are working far away from home. Yes, of course, the benefit is that the mother and the father stay together, but the drawback is that we no longer have the wisdom of our elderly people to take us through on how to take care of our children. So you find that the mother and the father have to figure it out on their own, and at times they use other platforms, which at times they may not be reliable. So today we bring before you Dr. Glen Rose Rukoto to teach us on how this can be done, on how we can look after our newborns as they come back home, and taking care of them with the understanding that we are raising tomorrow's future. And the basics, what you do to the young children in the beginning, is very important. Dr. Glen Rose, thank you so much for joining us. You may greet our audience.
I greet all the listeners who have tuned in. Thank you very much for having me on your show today.
Thank you very much, Dr. Glen Rose. We look forward to having a wonderful time with you as Prudent Women. We know we will never remain the same. And thank you so much for taking your time out of your busy schedule. I know that doctors are very busy, most especially the specialty where you are, because children are born now and then. So we'd like to say thank you for taking your time to be with us. We look forward to having this wonderful conversation with you. Thank you. And as we start this discussion, Dr. Glen Rose, we would like to invite you just to take us through, the first things that one needs to do when you bring back a child from hospital, a newborn. What is it that one needs to do? Maybe let us take an ad break. I see we are having a challenge with Dr. Glen Rose video, but we'll be right back with you. And even as you get ready with your questions, our listeners and our viewers, thank you, Dr. Glen Rose. We can see you are back with us. The challenges of load shedding continues to be with us, But thank you so much that you were able to get back with us. As we continue with the discussion, Dr. Glenn Rose, I was saying, we are excited as a couple having your kids, your newborn. What is it that one should expect to do when you get home with a newborn for the first time from the hospital?
Thank you very much, Sister Lani. Okay, so having a newborn is both exciting and a little bit, you get a bit anxious about it because there's this new person that is completely dependent on you for everything. And also, it's a person who the language that they speak is not the same language that you speak. So first of all, it's important to accept help when you have a newborn for the first time, because a lot of times, especially after giving birth, you need a lot of rest. So the main thing is to not be anxious and enjoy this new little bundle of joy. So you will have to learn things like how to bath the baby, how to take care of the umbilical cord stump, and also feeding the baby as well. So it's not to get accept help, and everything will go okay. Hello, Sister Rulani. I was struggling to hear you. Sister Rulani?
Can you hear me?
Oh, now I can hear you. I'm so struggled. Yeah. There was no voice for the past few minutes for me.
If you can take us through how to take care of a umbilical cord.
Okay. All right. So the main thing with an umbilical cord is that it usually dries out between 1 week and 3 weeks. So the main thing is to keep it dry and clean because it can get easily infected. So the important thing is each time you change the baby's nappy, you also clean the umbilical cord with your surgical spirit, and then make sure that you put on the nappy. Do not cover the umbilical cord. If the nappy goes above the umbilical cord stump, you can fold it down so that it remains dry. And then within a week, sometimes it can take up to 3 weeks, then it will fall off as long as you keep it dry.
Doctor, if
And
I
also,
may ask, what will usually be the reason? Because you know, with this taking care of your umbilical cord, I know most of the time it's because you will have heard that so and so's baby, the umbilical cord was off in the first 3 days, and yours is taking you are talking about 2 weeks and all that, and one start to panic. What will be the reason for the umbilical cord to take longer? Or what are the effects? What determines when the umbilical cord will fall off?
okay. So the main thing, like I said, is to keep it dry. So the drier the faster it gets dry, then the faster it will fall. So a lot of times, especially with nappies, we like keeping the umbilical cord covered, and also putting lotions around the umbilical cord stump. So if we can avoid those and just keep it dry all the time, and also if it's not cold, especially when you change the nappy, allow a few minutes before you put on the next nappy and clothes, allow it to air dry as well. So the drier it is, the faster it will fall off.
Thank you so much, Doctor. So it depends on how you look after it, and most of the time, you know, I'm talking from experience. You become so scared of the umbilical cord. Is there anything that you like to highlight to the ladies in terms of the dangers of not looking after the umbilical cord the way you are saying? Or, you know, there's no danger, it's just something that will just have to dry up and fall off?
Okay, so the important thing would be as well to keep it clean as well, because it can get infected, and if it's always wet and not clean, then easily get infected. So if you make sure that you clean it with each nappy change, and you dry it, then you will avoid things like infection. Otherwise, the baby is not feeling any pain because there's no nerves along the umbilical cord stump. So don't be afraid to handle it and clean it, because that will help in it falling off quicker.
Thank you so much. You know, I've had 3 newborns, and up until today, I didn't know that there are no nerves attached to the umbilical cord, and how you take care of it. At times, I think we tend not to do the right thing because you are so scared of that area, thinking that there are nerves and a whole lot of things there. And thank you, doctor, for this session. We are getting informed, and I trust that our young mothers whom I'm seeing here will surely take your advice and will do things better than us. You know, we are amongst those generations that had to go and do things on their own without the wisdom of our elderly mothers. And it was trial and error. And with Google having come, sometimes you don't even interpret what is being said correctly, because most of the time is different, you know, especially with different cultures and all that. So I would like us to take an ad break. When we come back, Doctor, having spoken about cultures, if you can take us through the cultural myths that are there, you know, which tend to affect how we take care of our newborns. Because if I'm married to another culture, they will say a whole lot of things that they believe in, and I have things that I believe in. But I trust that medical science, it's something that has been researched, and you know how things should be done, and we should take advantage of the medical science. So let us go on an ad break. When we come back, we'll talk on that. Welcome back. This is Bold Moves Radio. The show is Prudent Woman with myself, Rulani Baloi. Thank you for joining us today. We are talking on caring for our newborns or our infants with Dr. Glen Rose Rukoto. She is a pediatrician. She's here to teach us on how to take care of our newborns. Thank you so much to all of you who are watching or listening to us. And thank you for your comments. You are welcome. Please drop them down. We are here. We're looking forward to having a conversation with you, even as we teach each other and we become prudent on how to take care of our children as we go through the month of May, the month in which we are celebrating motherhood. Dr. Glen Rose, before we went on an ad break, of course, we were talking on taking care of the umbilical cord. And I know another area that women we struggle with is taking care of the genitals for our newborns. If you can assist us on how to do that for both male and female, how do one go about taking care of the genitals?
With our newborn babies, so each time the nappy is soiled, whether poo or with pee, we need it to change it as soon as possible to avoid excoriation of the genital areas. So each time your baby has pooed or peed, we change the nappy, and then when you change your nappy, you know that it's in a warm you have your wings, and you put the baby on a flat surface, so that you do, and also put a blanket so that you not soil around. And then when you remove the nappy, especially if there is poo, most of the poo you can actually use the nappy to remove. Then cleaning around the genital area, you can use other wet wipes or cotton wool with warm water. So with girls, make sure that you wipe from front to back to avoid poo going into the vaginal area. So you wipe from front to back, and once you've used your wipe to go, bring it back to the cause that can increase the chance of the baby getting urinary tract infections. So you make sure you clean also around the folds as well until you can see there is no poo. And then with boys, make sure even around the penis and around the scrotum as well, you clean around there. There is no need to pull back the foreskin on boys. You just clean outside, because especially when they are small, if you pull it back, you might have a risk, not a risk of it not being able to go back, because the opening is very small. So just clean outside around the penis and around the scrotum as well. And then also with that, you can, especially if it's a warm room or it's not winter, then you can leave a few minutes for the area to dry out, and then you can put your bum creams and then put your clean nappy on. Thank you.
So, doctor, the bum creams are important for us to put for our children, on our children. So, in a case where one does not have a bum cream, what can be used, which is an alternative, which is cheaper? Because I know bum creams can come at the, yeah.
Okay, so the main reason for the bum cream actually is just to create a barrier between the nappy and the skin. So the cheapest thing that actually your Vaseline that you also use on your baby, that would actually be an alternative as well.
Okay, thank you so much, doctor. And having spoken around the boy child, you said there is no need to move the foreskin. And I know most of us, that's the one area we thought it must be washed because it would get dirty and a whole lot of things. So linked to that, it makes me think of an issue of circumcision. I know nowadays we tend to have doctors and mothers who will propose to have a child going for circumcision at an earlier stage when they are born, more especially if you do not have desires to take them to for initiation school, because then it will still be done at the doctor's rooms. What will be your advice, or what are the pros and cons for doing it at that age?
Okay. So when it comes to newborn circumcision, so there are some cultures where in their culture they actually do circumcision for newborns, and in other cultures, so when the kids are older, then they can do that, and other people as well prefer to let the child themselves, when they are older, decide when they whether they want for circumcision or not. So the advantage that has been that most of the people, the reason why they born circumcision is because they want to try and prevent urinary tract infection, but shown to give that much of an advantage over an uncircumcised child. So it all depends on the parents or religious belief whether to do it or not. And then the cons would be with any surgery. There's risks that come along with it. Risk like bleeding, like infections. So when you decide if you want to do circumcision for your newborn, you must weigh those options to see, do you want to risk that things like bleeding, infections, which also really occur at the expense of you trying to maybe protect the child from UTI, which urinary tract infection, which hasn't been shown to give that much of an advantage. And these days, with children's rights, a lot of people are moving towards letting the child make that decision for themselves to say, I want to get circumcised or not. So it all depends on what the parents want.
Yeah, you are saying something that I never thought of, the rights of a child, to say they need to have a right to choose whether they want to be circumcised. But thank you for bringing that to our attention. I trust that, yes, of course, it depends on the preferences for the parents, because at that age, as parents, we are taking decisions on their behalf. And doctor, I said before we went on an ad break that there are issues, most especially around young children, newborns. You'll have a whole lot of cultural myths that are brought in, and mostly it happens in the first few months of a newborn. When a child is crying and you are told, I don't even have a word for it in English, you'll bear with me. I just trust that you will understand what I'm talking about. When a child is crying nonstop, you will be told, "Ngwana lo unarigoni." I don't know if you know, but I trust that as a pediatrician, you have met a number of women who have come through to you wanting you to assist with rigoni. Or I think in other languages, they may have a term for it. What would you like to say around this? Because it's one area that I know tends to give challenges to most young mothers.
Mothers who come with in what we call a stock bite. So yeah, they usually, when they say rigoni, we refer to it as a stock bite. So a stock bite is a either a pinkish or reddish, sometimes purple discoloration on the neck, or also on the back of the neck or the back of the head, which is not painful to the child, and it has been shown that it doesn't cause any problem in children. But most of the time, when parents come, once the child has that on their neck or on their head, then they will tell you that this child needs to go for treatment, and if they don't go for treatment, this child is going to die. So it has been shown that that as the child grows up, that usually goes away. So The problem comes when it comes, because different cultures, they treat it differently. So with some cultures it involves putting incisions around that mark on the back of the neck. And the problem with making incisions on the skin is that the skin protects against infections. And then if you make those incisions on the skin, then you've invited a place where bacteria can go and infect the child. And the problem with infections in children, in especially newborns, once you get an entry, then the infection can spread throughout the body. Then that's when the child will actually get sick. So, but otherwise, according to our knowledge, that mark will go away, but it's by itself. The problem is when the intervention that actually brings harm to the child is done. And also, in some cultures, they just give the child something to drink. And then the problem is we don't know, especially these days, we do not know what exactly is being given to the children. Some of the things that are put into this medication, you find that they injure the baby's liver, because the newborn's immune system and most of the organs are still immature. So if you give medication that you don't even know what is inside it, it may cause injury to some of the baby's organs. So that's where the danger actually comes in.
Thank you so much, Doctor, for highlighting us on that area in terms of rigoni, or you said the stock biting, that dark part that will be just behind the child's back on the head. And, you touched on how we normally will respond to such, to say we'll start giving the child medication that may be harmful. And that brings me to the next issue that I wanted us to engage on, the issue of giving the newborn medication. I may not want to mention them by name because we are on a platform that everyone can listen, and we don't want to be found as having discouraged people from consuming certain products. But we all know that there are medications that people will say, immediately you have a newborn, please give them so and so medication throughout, without responding to any sickness or any symptom. What would be your advice on that?
Okay. So my advice is that so we know that newborn babies, as I said before, they've got an immature immune system. Even their organs are quite immature, so they can't process some of these things that we actually put into their body. So most of the time when we use these products, we don't even check what is contained within this products. Okay, I'm also not going to mention the names of the products, but if you check some of the products, especially some of the products that we like giving quite frequently to try and prevent, others will say they're preventing colic or other diseases. Most of some of them actually contain alcohol, and some of them contain sodium bicarbonate, which may be harmful to the newborn baby. You give that to a child who's otherwise well, and then you may create problems according to how the child reacts. And some of these things, other children as well may have allergic reactions to these things. So it's advised that for the first 6 months, the thing that you give that has most of the things that the baby needs, including antibodies to treat infections, it's breast milk. So when you give a child breast milk, you are actually giving it's more than just food. You also have things inside the breast milk that help fight things like infection.
Thank you so much, Doctor. You mentioned a very important point, that breastfeeding is the most important element when we talk about the feeding of a newborn. Um, today's lifestyle and expectations in society, and our very own expectations as mothers, brings about a lot of challenges, even though some of them becomes opportunities. what will be your advice in terms of a breastfeeding plan? Because, we are cautious of how we eat, So you'll get young mothers saying, I don't want my child to be overfed. I don't want my child to be obese. And so, at us coming from that era, we tend to think when a child is healthy, they must be big. So when we see a thin child, we feel they are not healthy. What will be your advice in terms of feeding plan, more especially breastfeeding?
So for a baby, it's thought that from birth up until 6 months, it's breast milk alone with no supplements of water or any other supplements. It is adequate for the baby to grow. So from the first 6 months of life, I would have advised where it's possible, because there are situations where it's not possible for the mother to give breast milk. Where it's possible, as far as possible, try to give baby breast milk exclusively without giving any other supplements. Then from 6 months onwards, then that's where you can introduce your supplement feeds, that your soft or you can do other mashed or blend that you can do at home. So usually from about 6 months, because now the baby will still be trying to get used to these textures. So usually start at about 2 to 3 spoons of whatever mashed or blended feeds that you can give, and you can aim to eventually get to 3 feeds in a day, where a feed would be half a cup of a feed. You don't have to force food on a child. And then as they grow from 9 months, there you can start giving them chunky foods, and continue with your mashed foods. And also you can start giving them foods that they can actually pick up with their fingers and put into their mouth. So when it comes to restricting babies, especially, we have your fat reduced milks and all those things, the best thing will still be to continue with breast milk. But where not possible, then that's when you can actually add for baby formulas, because the main the one thing that contributes in a baby should still be milk, be it breast milk or formula in cases where feeding is not possible. So that should still be given actually up to the age of 2, in conjunction with feeding. So don't try to give the child fat reduced, because so they need all those nutrients for them to be able to grow. So don't restrict them like you restrict the adults. Thank you.
Thank you, Doctor. And I see you, all our viewers and listeners here on our channel. I see Bo Mama Tsakan Mabasa, Sesim, it's Mbilayelo Chamishe. Appreciating you, Doctor, to say you are a woman of virtue. And I see Chriswell Balo here saying that he knows that when a child has eaten, they must be ndangu. I think it's what I was referring to say we believe that a child their stomach must be full, to show that they've eaten. And you mentioned one point, Doctor, to say at a later stage, other formulas can be introduced, and also to indicate that, yes, there are instances where one wishes to breastfeed, but it's not possible, and we cannot rule it out. It happens. So, what will be your advice in terms of the bottles that can be used? Because there's quite a huge variety of bottles in the marketplace, but we understand that there are certain bottles that are correct to be used for a child. in order to, I've heard some will say this type of bottles will cause colic and this and that. So what would be your advice in terms of the types of bottles that should be used when we have to use formula because of the circumstances that are presenting with us?
Okay. All right. So yes, there's definitely a very wide variety of bottles in the market, and then I'll just speak of the main types of bottles that are available. You get your glass bottles. These ones are usually very expensive, but they last for long, and they are easier when it comes to sterilizing compared to the other two types of bottles. And then the con is that if they fall, then they can break quite easily. And then you get your silicone bottles, which are very, very rare. They are hard to actually come across. That's when you don't want to use plastic bottles, and you can't really afford the glass bottles. They are also, those ones are the only side effect. I mean, the only con is that they're not easy to find. Not many manufacturers actually do them. And then those ones are actually quite light and easy for a baby as they grow. They're easy for them to hold. And then the main type of bottle, it would be the plastic bottle. So the plastic bottle, the con that was there before 2012, there was a chemical called BPA that was found in plastic bottles, which is thought to release some chemical, to be released into the milk, and then cause problems later on in the baby's life. So, but since 2012 in South Africa, they've banned those bottles as well. So the advantage with plastic bottles is that they are cheaper compared to the other two types of bottles. And there's a very wide variety of bottles, also with the nipples that come with them. And then you get your anti-colic bottles, very different types of very big variety, where you can really be able to choose what is best for your child. So most of the time it will be on a trial basis, and not that we have any evidence to say a normal plastic will be less better anti-colic bottle. But then that would also depend on how your child as well responds to those kinds of bottles. So most of the time, the cheapest one will be your big bottle, as you sterilize them correctly. And also, because to the glass bottle, they wear off quite quickly. They start becoming cloudy. So you need to change them as soon as they are not good anymore. So that's what most people go with, the plastic bottles, as long as they are sterilized correctly. Because with the bottle, there's the two stages of actually cleaning them. You first wash the bottle with your soap and warm water, and then you get the second stage, which is sterilizing, especially if the child is under the age of 1, because we said their immune system is still immature. So you want to make sure that when you give the milk to the child, the bottles are actually sterile.
Well, I realize that this topic, caring for our infants, is huge. You'll agree with me, our viewers and listeners. We still have a long way to go, and our time is not with us. But I love that how our good doctor is answering our questions. And I trust that, of course, we say in Prudent Woman, we are about sparking conversations, and you'll be able to take these conversations forth with either your pediatrician or within your circle of friends to talk on how to go about these things. You know, who knew that when you're buying a bottle, it's not about how beautiful it is, but you must consider certain elements to understand that this will be good for your infant. And of course, to know that our government cares so much to look after such things such as a bottle, to be able to even ban bottles because they are causing this and that, that brings a lot of confidence in our government. And I would like to say thank you. Thank you to everyone who's listening, watching us. Of course, we have with us Dr. Glen Rose Ricoto. She's a pediatrician. We are talking on caring for our infants. If you have just joined us, as we move right along towards closure of our session, Doctor, once everyone has eaten, they surely have to go to the bathroom. And that is another area that baffles us as young mothers. What you normally will see with your newborn, you've brought along this bundle of joy. And when you look at the nappy, they've got something surprising. I cannot even explain it, but I'll leave it to you as the doctor to explain the different stages of their poop so that we are not scared as young mothers.
Okay. So when it comes to baby's poop, so it may be different from one baby to another. In the first month, they some babies may poop up each time they breastfeed or they feed. They may pass a stool, and then there are some babies who will pass maybe 2 to 5 times in a day. But as they grow older, between 6 weeks and 3 months, then their poop becomes less, especially if the child is being breastfed, because now the gut is absorbing the breast milk quite effectively. You may find them pooping maybe once in a day, and then others may even poop once in a week, depending on how they process their food. So even if they pass once in a week, you can't say that the child is constipated. For us to say the baby is constipated, you must actually see the baby passing hard stools. If at the end of that 1 week or 3 days they pass a stool which is still soft, still the normal poop, then they're not constipated. Then you don't need to worry. As long as their stomach is still soft and they are passing gas and they're not vomiting, then you are still okay. You don't have to panic.
You so much. I see the prudent ladies here saying this is very basic information, but they appreciate it because these are things that we all tend to think is basic and no need to be taught on, but it baffles you once you have to face it. Thank you so much, Doctor. I see your colleague, Dr. Mkiti, here saying thank you for guarding our children, Glenn. She's appreciating the work you're doing. Thank you so much to both of you. You know, our doctors do a wonderful job in caring for us as people because it is your scientific knowledge that assists us to stay healthy, to look after the career of our human beings, especially our young ones, because as a child, they do not know what's happening around them, but it depends on the knowledge that you have as a parent in order to be able to diagnose them as they are crying, as you said, when the tummy is still soft. So it's upon you as a parent to be aware of all these things so that you can help to diagnose and be able to bring relief to that young one. Doctor, I think our time is not with us. I will want us to go in and talk on the sleeping patterns for our newborns. And as you talk on the sleeping patterns, with what is acceptable for a young child to be a good sleeping, because at times you bring back the child, they are sleeping the whole day. You do not know when to take them and rush to a pediatrician because you are not sure whether they are healthy or not because they're just sleeping. And again, when you are excited, you have this child coming back, we prepare the room, we have a crib, we have toys in the crib. Is it important? Is it the right thing? Will it cause any danger? So if you can take us through the sleeping patterns and what can we have in the crib and at what age?
Okay. So with our newborns, they usually sleep from 12 up to 16 hours. It's just that time would be they sleep for a short, because they have to feed quite often, so they will wake up in between, but in total they can sleep to 12 to 16 hours, and in that time they really can't differentiate between evening and day. So we as parents would be the ones who actually set the tone, so that they'll be able to, as they grow, to be able to differentiate between night and day. So the best thing is at night when they wake up to feed, make sure that the room is dim, and then it provide a quiet area, so that they know that this is night. And then, as opposed to during the day, where they will be, make sure that it's light, and also you'll be playing with the baby in the feet, so that they are able to differentiate between night and day. And when it comes to the cot bed, um, less is good. So you don't need to put a lot of toys or a lot of blankets and pillows in the baby's crib where they sleep, because all those things, they are a danger hazard, including our cot bumpers and our big duvets. They and big fluffy plushy toys. They all a hazard for babies to choke on, because when they are still small, they can't even be able to avoid danger. So the best thing, make sure that it's a flat surface. There isn't a lot of things around in the bed, so that you can avoid the baby from getting suffocated unnecessarily as well. And then the
Thank you so much, Doctor, for such enlightenment in terms of what to have in the crib and how long should a child sleep. And that brings me to a question, Doctor, on, you when you have a child, you are bound to start comparing. You want to learn from another parent on how things have been going, so that at least you have an idea, because you've got someone who has just joined you, but this person never speaks to you, never tells you that tomorrow, just yesterday when you were not here, I was able to raise my head. So you learn from the next from the neighbor. And at times it tends to make us panic, because our children do not do things the same way. Some will delay far much more. So, what will be your advice in terms of the things that, as a parent, I need to observe to be sure that my child is well and okay?
So from I'll start with newborns. From newborns, they can recognize light. So when you turn on a bright light, they must be able to close their eyes, to show that they can see that there is bright light. And also, if there's a loud noise as well, then they should startle to that. And then the other things that you should watch for, that are red flag. Usually, if you look at the road to health card, which is the clinic card, that card is not only for healthcare workers. It's made for both the parent and the healthcare worker, as the medical record for that child, but as also as information for the parent. So it will also tell you that if your child is not sitting by 9 months, and if your child maybe is not walking by 1 year, 6 months, then you must get worried, because different babies will reach their milestones at different ages. But then, let's say for instance, walking, other kids will walk by 10 months. But if your child is not walking by 1 year, 4 months, unless there are other things that you notice, then you do not need to worry about. But if the child reaches 1 year, 6 months, and they're still not walking, then you must start worrying about, or reach 1 year, 6 months, and they can't say a single word, then you start worrying about that. So the thing to remind us on what to look out for, let's read our road to health cards. It's not just for the healthcare worker, it's information for the parent as well.
Thank you so much, Doctor. Would like to appreciate you for having taken your time out of your busy schedule to come and teach us on how to take care of our infants. And of course, we could not exhaust all the questions that our listeners and our followers have been sending through to us. Would like to say we will request you to come back and continue with the topic, because it's just a lot. We could not exhaust everything. So as we draw to a close, Doctor, I know that in the health sector, time and again, you'll have outbreaks and a whole lot of other things that are there. I would like to invite you, as you bid farewell to our listeners and our viewers, to just alert us of any outbreaks that we should be careful or be looking out for that is already out there.
Okay. So yeah, recently there has been increased cases of mumps that have been reported. So mumps is a vaccine preventable disease where you get inflammation of the salivary glands that are on the jaw, just below around the angle of the jaw. So the child will usually present with, they usually have headache, they've got fever, they're just feeling miserable, and then followed by the inflammation of those salivary glands, which is very, very painful. So most of the time, it's usually a self-limiting viral infection where you just treat symptomatically, you treat the pain, you treat the fever. But then there are instances where it can become severe and cause infection in the brain or in the ovaries or in the testes. So because it's a vaccine, most in our normal vaccination schedule in the government, we do not have that vaccine for moms. But in private, there are vaccination, the combinations of mumps, measles, and rubella. So usually it is passed from one child. It easily passes from one child to another. So the only way to prevent it is either vaccination or if the child has had it before. So that also provides prevention to the child. And then the other outbreak was measles. There was already a campaign where they're going to schools and giving the measles vaccine. I think the most important cause of that was that through that, especially during COVID, vaccination was not happening as it should have been happening. So that's why we will end up seeing a breakthrough of all these outbreaks everywhere. Thank you.
Yes, thank you, Doctor. That was Dr. Glenn Rose Ricotso, our pediatrician. Thank you for being with us on the show. We would like to say thank you even to our technical team, Brad Desmond. Thank you, DJ Messi. And of course, Pastor Strike would like to say thank you. The show will not have happened without your assistance as the team behind us. Thank you so much. And of course, all of you who have been with us, thank you for joining us. Would like to say bye. You know, when we finish Prudent Woman before 5 o'clock, it's because of load shedding. So our apologies, we have to end instead of us being ended abruptly without us being in control. We'd like to say thank you. And we have seen all of you have been joining us. Please continue. You can share this wonderful session with your loved ones, more especially those whom you know are expecting children or they already have small children, and this information will be useful for them. And I would like to invite you. Bold Moves Radio has got a full pack programs every Monday up until Friday in the mornings. We have our prayer sessions. We have African Experience on Tuesday. On Thursday, we have Love SA. And tonight, just now, we're going to have another show. Please stay tuned. You shall never remain the same. Thank you. Have a blessed week. We shall be with you next week. Same